a 48-year-old white male, Mr. Whaley. He has been admitted to the medical surgical floor in a large hospital. He stumbled and fell, fracturing his right tibia. A month earlier, he went to the doctor's office complaining of unusual fatigue and recent weight loss. Diagnostic tests now revealed the patient has lymphosarcoma involving the brain and the bone, a type of cancer that is likely to be fatal within a year with chemotherapy.
Hi, Mrs. Whaley. How are you doing?
I'm good, Dr. Lance. How are you?
I'm okay, but I have some bad information to give you about your husband. When he came in about his broken tibia, we found out that he actually has cancer. He has lymphosarcoma, and it has a very high morbidity rate. Even with chemotherapy, he could only live for maybe a year.
So you're saying that he's dying?
He's dying, yes.
He's going to be devastated. He just lost a friend a couple of months ago from cancer. And as soon as he told us this, that he would give up on living. And I can't lose my husband. My daughter's in college right now, and she's coming home in another week. She has finals, and we cannot let him know that he's dying. He'll give up. Dr. Lance, you understand? He will give up because he does not want any kind of treatments. He will give up, and you're saying a year.
A year. Well, if you don't want to tell your husband right now, we can wait. And we can wait until do you want to wait for your daughter, or do you just not want to tell him at all?
He's going to have to find out, right?
Eventually, I'm going to have to tell him. But if you'd like to wait on your daughter to come home so y'all can be present as a family, you tell him.
If we can wait at least a week for her to get here, I would really appreciate that.
Okay, I don't see a problem with that.
Thank you so much.
Thank you. Hi, how are y'all doing?
Good. How are you, Dr. Lance?
I'm fine. I have some information to give you about Mr. Whaley. Now, we know that he has cancer, and we're actually going to wait to tell the family, well, to tell him when his family's there at the hospital with him.
Why are we waiting?
The wife wants to wait until their daughter gets home from college, and I think that would be best for the whole family to be there when we tell him. So just don't let it slip. I'm not going to tell him anything. We're going to wait until the daughter gets back from college.
When will she be back?
A week.
Regarding the treatment of Mr. Whaley, this would be the incorrect way to perform care.
Here, Mr. and Miss Whaley. I've got your morning medications here, and I brought you a juice just in case you didn't have anything to drink. And I've got you some Zofran. I know you said you were nauseous earlier.
What kind of medicines am I taking?
Well, that is your Neupogen and your Decadron.
I have heard of Decadron. What's Neupogen?
Neupogen increases your white blood cell count.
But I thought my white cells were fine. I didn't know I had an infection.
Well, it's not necessarily for an infection. It's, well, you know, Mr. Whaley, it's actually when your body is in a state where it can't make those cells, or those cells are getting attacked by something else.
I don't think I really understand exactly what you're saying.
Well, Mr. Whaley, because I'm a patient advocate, I'd just like to tell you that I don't agree with what has happened in your care, and that you have a right to know that you have cancer.
You say
There's an explanation for this. I need to talk to you outside right now.
No, there is no explanation. This is just...
Come here and talk!
According to the Code of Ethics and the theories of autonomy and beneficence, with Mr. Whaley, we have to respect the wishes of the family for them to wait for him to find out that he has cancer, but he also deserves to know. So we chose to wait the week till his daughter and family got here where he could find out he had cancer.
Regarding Mr. Whaley's care, this would be the proper way to treat the patient.
Good morning, Mr. Whaley.
Morning.
How are you feeling this morning?
I'm a little nauseous, but
Well,
I'm okay.
I've got you some Zofran here for your nausea. And I've got your morning medications, and I brought you some juice in case you didn't have anything to drink.
Okay, what are my morning medicine?
Well, this is Neupogen and Decadron.
Okay, what is Neupogen?
It just increases your white blood cell count.
Okay, but I didn't know I had an infection.
Well, Mr. Whaley, it's not necessarily for an infection.
Okay, I still don't quite understand.
Well, I'll have your physician come in and talk to you about your condition.
Okay.
All right, Mr. Whaley, is there anything else I can get for you?
No, I think I'm fine right now. But I'll just be waiting on the doctor to come talk to me.
All right.
Come in.
Hi, Mr. Whaley. I brought your doctor in to talk to you about those medications you had some questions about earlier.
I asked her about the Neupogen earlier, and she said it was for white cells, and I didn't know you could have an infection this early after a broken leg.
Well, after we did the lab test, we found out a little bit more about your condition. After we ran the labs, we found out you have cancer. It's lymphosarcoma. It's a very bad type of cancer. You have bone cancer and it's spread to your brain. And even with radiation or chemotherapy, you're only going to have about a year to live if you choose to do that.
I'm at a loss for words. I thought I was too young to get cancer.
Anybody any age can get cancer. Children get cancer. It just, I don't want to say, but it's the luck of the draw. There's no one way that we can diagnose or know who's going to get cancer. There's no age limit on it.
You know, you said after Randy died that if something like this ever happened, you would give up. But you have me and Emily to live for now. And, I mean, we're your family and we're here for you. I know it was bad of us to try to keep this from you, but I thought we all should be here with you. And I know this is going to be a rough road ahead of us, but you know we're here for you. So the thing now is decide if you want to do treatment or it's up to you. But it's up to you. Whatever you want to do, you know we're here for you.